Hello and welcome back to another edition of Spilling the Teath. As always, I'm Alan Mutton here with Henry Shine One, and I'm in London for once. I can't believe it. I'm actually down south, and I'm with a really great guest, Dr. Farzeela Rupani from Colosseum Dental. I'm going to hand over to you to talk a little bit about who you are, how you got here, because I think that's the most interesting way to get that over. So over to you to give us a bit about you.
Brilliant. Thanks, Alan, and thanks for having me. Delighted
Absolutely
to
no
be
worries.
here and delighted that you came to visit one of our practices in London here today. So, as you said, I'm Farzeela. I'm the Chief Medical Officer of Colosseum Dental in the UK, but also across Europe as well. So, Colosseum Dental are the biggest European DSO. We're the largest one with over 620 clinics in 11 countries across Europe. And we are a growing group, and we have over 4,000 clinicians working for us. So it's a really great place to be working. And in my role as Chief Medical Officer, I basically am in charge of the clinical strategy, the medical strategy, the compliance, the governance, but also the business strategy as well, supporting operations and learning and development and education. We've got a Colosseum Dental Academy where we try and upskill not just clinicians, but also our other team members as well, because I think it's so important to upskill all of the team to get to where you need to be and deliver the best patient care that we need to do.
Absolutely. I mean, you've said it there. There's a lot of weight on your shoulders, so I'm so glad that you gave us the time to chat today. I think a lot of people would, love to hear your opinions, love to hear what's going on. And as I say, you can give that European perspective, which will be the first guest that's been able to do that. So that's really, really, really fantastic. So thanks for being on. Um, let's sort of dive into like your history of being a leader and being a leader in dentistry. Um, you've had a really diverse clinical strategic background, gone through strength to strength. But let's go back to when you first knew you wanted to be in leadership and sort of get into that strategy, that CMO world. Um, what made you realize that that's kind of where you wanted to be long term?
So I think it was quite early on, actually. I mean, I grew up in quite an entrepreneurial family, no one really in the medical industry. And so a lot of my family went into business. However, for me, because I really loved the whole clinical medical side of things, I always thought, okay, I'm going to do medicine or dentistry. Decided on dentistry and started out doing dentistry and absolutely loved it. But after my second or third year, I started thinking, okay, I know I want to do more. I love being on the ground at the front line seeing patients, but actually, I want to have more of an influence from a strategic level, and I want to be a voice in the boardroom for our clinicians. And so I decided to do an intercalated BSc at Imperial College at the business school, which was management with health sciences. And that gave me the taster for, business, for leadership, organizational behavior. And I really enjoyed doing that year of my BSc, came back to dental school, finished off my clinical dentistry. And then when I graduated, I went into working in different practices, which was really enjoyable. I worked in mixed practices all across London and Hertfordshire and learnt a huge amount in terms of the clinical side of the business. But again, had a bit of a thirst for wanting to do more. So went off and did a master's in international healthcare management, which again gave me a little bit more of an edge. And I learned more about what you could do at a strategic level. And after that, I actually went and worked for KPMG in management healthcare consulting. And I was working with NHS trusts, helping them to become more productive, more efficient in their ways of working. And then following on from that, I went and worked with the General Dental Council for 9 years doing fitness to practice work. Also started teaching at Guy's and King's Hospital, and then spent 4 years at a large distributor in the UK as well. So got a well-rounded experience. All through this, I was working clinically, but doing non-clinical roles at the same time and just building my skills and my foundations so that I could eventually get to the role that I'm doing now as Chief Medical Officer. But I think it gave me a rounded approach because I had knowledge, insight from different areas of our industry. And I think it really helps me do my role today.
So I think the thing that really interests me about everything you talked about there, your whole history, the industry knowledge that you've built up over many years, is that you didn't cut corners. And I think that's one thing we see nowadays, is that people will be in university, for instance, and they'll say, yes, I want to be in a leadership role in dental, within the next 5 years, and they go and make it happen. And I feel like your version of that dental history actually builds credibility, and is probably the right way of doing it. So do you agree, and do you think that that's the right way to get to a role such as yours?
So I would say there's probably no right or wrong way. And I think some people are natural born leaders and they can be very successful from early on in their career. And for some people, it comes later on. I think for me personally, building up my skills and experience over the years has given me that credibility to be able to have certain conversations in my role. The conversations I have sometimes with our clinicians can be quite difficult, can be quite tricky, especially if you're dealing with clinical concerns. And I think if you haven't got the experience of doing it yourself, seeing patients yourself for quite a long time in practice, in clinic, knowing what it's like on the ground, then sometimes they find it quite hard to trust you and to believe you. And so I do find that because I worked in practice for so many years and I worked in really hard, high needs NHS practices as well, I actually know what it's like to work in this type of environment. So I can have constructive conversations with our clinicians. But similarly, I think when I'm speaking at a board level and when I'm speaking to my fellow executives at a senior C-suite level, they also know that I've been in the industry for quite a while. I've worked in different roles. And I've gained that experience and I've gained the network of people to actually understand different levels of the business. And that can also help to convince them about the direction that we should go in.
Yeah, absolutely. And I think, not just the clinical, but also the compliance background, the legal background, like, you know, getting that toolkit ready to actually utilize, I think makes you a very, very strong leader. And it's very clear for people to see. So
And I think
that's good.
on that point about, dealing with complaints or the legal side of things, that's obviously a huge concern for all clinicians, no matter where you are in your career, whether you're at the early start of your career, midway, or at the end. If you get a complaint, if you get a concern from a patient, it's not a nice thing. And because I spent 9 years working with the GDC, I know what it's like from that side. I also know what it's like personally from my side. And it helps me to have conversations with our clinicians and actually help get them through the tough times. And I've recently dealt with a case where I'm helping one of our clinicians deal with a case and they are really struggling. So I think being able to talk to someone who knows what it's like, who can advise you, who can help you through it, is a really great thing to have. And I hope that they find me approachable to be able to talk to me about these things.
No, absolutely. And I think that if we sort of dive into your role, like specifically around like actually being a CMO now, like what is it that kind of drives you nowadays? Is it still that care? Is it more the culture of Colosseum, or is it the challenge that you face in that continuing to grow whilst being the largest?
I would actually say all three.
Yeah.
Care for me, caring about our patients and doing the best for our patients is, of course, a priority. But also, I care about our people. We've got, like I said, thousands of people working across the business within the UK, but also Europe. And I really care about creating the best working environment for them so that they can actually create the best environment for our patients. So we want to be the first choice for our patients, but also the first choice for our clinicians and our other team members so that they enjoy working with us. And I'm really proud to say that consistently year on year, our Great Place to Work scores have gone up. And now actually we're also classified as a best workplace in the UK for super large organizations. So we're up there with the likes of Hilton, Cisco, Specsavers as well. So we're doing really, really well. We're getting really good feedback from our team members on the ground. And we've tried to create this culture where people feel happy, comfortable coming to work, but they're also driving the business forward so that we grow together. And we actually try and build an environment that works for them and works for our patients. And I'm really proud of that. We've come such a long way. When I started in my role at Colosseum, which was right at the beginning of 2022, our clinician dentist churn was at 58%. Now our dentist churn is at 12%.
Wow.
So we have come a huge, huge way. Super proud of that. We've put a lot of time, effort, work into doing that. And I think all of our team have contributed to this success. And we just want to grow, keep getting bigger and better. It's challenging. So I think to your third point, it is a challenge and it's a juggle. There's a lot to do. Because I do a UK role and European role, I travel and you want to give your best all the time. But I enjoy that challenge. I thrive on the challenge. I love working with our teams. I feel supported by our teams. So I just think it's a brilliant place to work as well.
Amazing. I mean, it's definitely an ambitious project here at Colosseum, but it's a successful project, and that ambition doesn't get lost on you very clearly, but the success is also very clear for everyone to see. But one of the things that sort of really strikes me, and being here in one of your practices as well, it's a very modern practice. It's kind of we're getting to that future in practice, but now. Um, how are you kind of bringing that to life across the Colosseum estate?
So I think it's really good to try and embrace all of the tech that's out there to try and create a modern experience for our patients. I think as well as looking at technology such as AI and cloud-based systems and the actual equipment scanners that you use, the whole patient journey and your patient experience also has to be modern because times are changing, things are changing. So, we're looking at different ways that we can enhance our patient experience. At the moment, we're in the process of trialing a care center, a bit like a call center, because we think this will enhance the customer journey, our patient journey. We're also looking at offering different treatments to our patients. We are investing in doing more aesthetics in clinics. We've invested in lasers. One of our clinicians is doing ultrasounds, facial aesthetics. We're getting a lot more digital. And we're also doing AI pilots for diagnostics on x-rays as well, which is very exciting. So there's a lot going on. And I think it's brilliant to embrace all the brilliant tech that's out there, but do it in the right way as well. Because I think it's got to be right for your patients and it has to deliver the right care for your patients. It's got to be easy to use as well, because the last thing you want as a clinician or a team member is to have something that's tricky to use and then it impacts on your time and it causes you hassle rather than making you more efficient and more productive. So I think it's got to be right for the patients and the practice and the team. And then of course you need to get your return on investment as well. So from a business point of view, whenever I look at any piece of tech or kit, I want to make sure that we're getting the ROI, otherwise it's not worth investing in.
No, absolutely. I think definitely for me, something as a technology provider, it's very clear to see that change management has been like one of the biggest strengths for Colosseum, especially in the tech world. So, we know that you've recently moved your PMS across, and probably it's been the best example of change management in the industry. I don't think many people have been able to do it quite as well as you guys have. What was the point where you thought, yes, now's the time to change, and how did you manage that change management so well?
So I think we really found out that our data was all over the place,
Yeah, as it normally is.
as it
Yeah.
normally is. And we were on two different PMS systems across our 80 practices. It was just really difficult to manage. You had all these local servers, they caused problems. So moving to a cloud-based PMS, Dentally has been brilliant. So thank you to the team for that. We realized this was the only way to go, so that you could access your data remotely, you could have access to all the important things you need to know. And the way that we did it was explaining the why. I think whenever you're going through a change management process, you will have resistance, and sometimes people don't see that there is a problem. And if there's no problem to fix or to change, why should I change? Why, I'm doing fine on this other PMS. Why should I bother changing? It's going to take time, effort, training. I've got no reason to change, is how some people will probably think at the start. So I think you really have to plant the seed and explain to them the why, the bigger picture. Why are we doing this? What is the benefit to the business, but what is the benefit to you in the long term and individually? And that kind of what's in it for me is so key. And I think we were banging the drum on this continuously before we did the transition and all the way through the transition. We had an amazing project team from our side, but also from the Dentally side, helping us with the rollout. We did it in phases so that we could learn from each phase and we could mop up the mistakes that we'd made previously and make sure it didn't happen in the next phase. So we tried to be quite careful and measured in the way that we did it. But we were constantly explaining to our teams that this is why we're doing it, this is why it's going to be a good thing. And of course, we had ups and downs, we had a few hurdles to get over. But I think all in all, it went really well, and the team are super appreciative of it. And I'm appreciative because I can be in any practice and basically see what's going on across the estate, which really helps with the work that I do. And if I need to retrieve patient records, it's easy to do. And I think it's just such an important platform for us and helps with data capture and making sure everyone knows what's going on in the business.
Yeah, absolutely. I think one word that you didn't mention, which I think is really, really great, is fear. And that's something we see a lot with change management projects, is that, you know, we had to stop people being scared. And actually what you were talking about there is taking people on that journey so they never get to the point of fear.
Yes.
And I think that's something you guys did really well.
I think generally, actually, with a lot of the projects that we roll out, we really ensure that we take them on that journey because our culture is about being open, honest, transparent. Actually, that's the reason for our success, for the reason that we've turned around this dentist churn that we had right at the beginning when I started. We try to be open and honest with everyone and just tell them how it is, not, hide anything. Because I think if you take people along on the journey and you're very transparent with them, with your communication, even if things aren't going to plan, that way they will build up the trust in you and they'll remain loyal and they'll want to help and support you on the journey.
Absolutely. So, let's dive into some specifics around that tech. And you've touched on kind of all of these. So we've talked about AI imaging, we talked about predictive dashboards, but there's more and more coming out all the time. There's voice notes, there's AI phone systems, there's CRM systems. What excites you the most in what's coming out in tech? It can be physical, it can be software, and where do you think that kind of technology will be going soon? Do you think it will evolve, or do you think we're already there?
So I think so many things are coming out constantly. It's already evolved in the last few years and still continues to evolve. I think I'm excited about just making our workflows more streamlined, more efficient. I think sometimes things can take so long to do in a practice environment. And if you can speed up the process by using tech, that's going to make you more profitable. It's going to make the experience better for our clinicians, for our team members, for our patients as well. So I fully want to embrace that. And I'm excited about seeing how many of these various technologies pan out. And I think some will work better than others depending on the environment, but you've got to be all in and embrace things and try things out before you know what works for you.
Yeah, absolutely. And with things like AI, do you think the role of the dentist is going to change in the next 5 to 10 years? Maybe from just straight clinician to more of an educator, or do you think there's other ways that will evolve?
Yeah, I think at the moment we are supposed to be educators as well as the clinicians. However, the benefits of using AI, for example, in imaging is that it gives you more of a communication tool that's very visual. I remember when I was in practice, like 10, 15 years ago, I'd be using Google or like drawing pictures for my patients to show them, okay, this is your tooth, this is caries, this is where your pulp is, this is the treatment I want to do. And it was a bit of a faff. Whereas nowadays you've got all sorts of variable programs out there, the AI that, where it shows you where your caries is on the images. There's so many things that can show you visually and in a much better way than my messy drawings, which can help educate patients. And it also gives them a nicer experience as well because they feel like you're giving them something modern, something up to date. We've had retinal scans in our opticians for many, many years. So I think it's about time dentistry caught up and started offering that experience to our patients as well.
Absolutely, yeah, couldn't agree more. I think there's so many good patient education tools out there, and imaging's one, but there's video-driven treatment plans. There's all sorts of things like that, and I think the more and more we can do that, the easier the dentist job becomes, because people are invested in their own oral care rather than thinking of it as a biannual chore or something like that.
Yeah, and people learn visually, and in our world nowadays where everyone's going on YouTube or, socials, etc., to gather information, if they hear that from a professional in a clinical environment and you show them the right information and it's very visual, there's some nice videos, some nice graphics to go with it, I think you can land that message very well.
Absolutely, absolutely. Now, I won't bore you with talking about AI for the whole conversation, because I know that's on everyone's lips all the time. But I think one thing that definitely you're going to be able to help our listeners with, but also educate me on as well, is around women in leadership. You're a very influential leader in the space, very visual leader, a visible leader in the space. What advice would you give for women aiming to get in that clinical leadership space, and working up in the same way you have?
So I think just be you, be credible. Don't try to be someone you're not. For me, I think I'm also a fan of people in leadership and not just women. Of course, I advocate for women, but I also have two sons. So for me, I really want my sons to see that there is a place for men and women in leadership roles. And it's actually about the right person in the right role. But for women more specifically, I mean, one of the things that I struggled with was obviously when I took time out to have my kids, I was really worried about, am I going to be able to still keep working? And I ended up working during my maternity leave so that I could juggle and balance everything. And I felt really guilty as well about working, but then also trying to be a mom and juggle it all. So obviously, women are the ones that give birth to children, but it doesn't mean that other people can't get involved. And what I would say is that reach out for help. Reach out to your family. If it wasn't for my parents, my sister, my husband, in-laws, the people around me who have supported me in my journey, I couldn't do what I do and also be a mom at the same time. But I also think it's about being yourself. And sometimes, if you're just down to earth, you are not trying to be someone you're not, that helps to give you the voice that people need to encourage them and motivate them to succeed. And I also really believe in empowering people around me. So, again, I wouldn't be able to do all the various roles that I cover within my role if I didn't have a good team around me. So I've really tried to empower my team around me, both in the UK and across Europe. I try to delegate to them. I should probably delegate more, and I'm
We
learning
all
to do
should. We all
that.
should.
But I do try and empower them to take ownership of projects, of things that they want to do as well. So they support me in my journey as well. And I would just say lean in, get involved. One of the things that I struggled with initially was being nice to someone, but also making tough decisions. And I think also being vocal in a room which has got predominantly male figures in it, if you're the only woman in the room. I did probably struggle with that initially, but I think don't think of it as a male or female battle. We're all trying to achieve a common goal in a business. So if you work together and you support each other, you can actually enhance the journey for yourself, but also your peers.
Absolutely, and I think that's something that dentistry does so well, is like that community aspect. We're all in this together. There's a lot of sharing of information. People always joke, "Oh, everyone knows everyone in dentistry," but that's because we've built that support network so strong. And I think you're absolutely right. Reaching out for help, but also reaching out for questions and trying to grow using the people around you, not just trying to do it alone.
That's what I love about our industry, actually. The fact that everyone is quite helpful and open and they will guide you, even with your competitive DSOs and the competition amongst us. We all talk to each other and we try to help each other and guide each other, because you can just learn from your peers. And that is super helpful within our industry, and we're very fortunate to have that.
Definitely, definitely. Do you think that there's something there's something more the industry can do? I think we've already talked about it's actually quite good for that kind of community aspect. Is there something we could all be doing more to help support each other grow?
So I think dentistry is tough. It's a tough environment to be in and to work in, especially if you're working in an NHS environment. The majority of our practices are mixed practices. And we hear all the headlines about NHS dentistry, the lack of funding, etc., that goes on. But I always try to put a positive spin on things, and I am kind of glass half full type person. So I just think that, yeah, things are hard, but how can we find solutions, ways to work together to make things viable for us, to make the NHS work for us where we need to build in private treatment plans and private care for our patients so that we can still be profitable, so that our clinicians can earn what they want. How can we better use data that we have access to guide our decisions and actually take measured decisions? I think if you're just taking decisions nowadays that are not based on evidence or data, then you're missing a trick, because we have access to so much. A lot of us use Power BI systems and we know exactly what's going on. So I'm really keen on using that in the right way to motivate our teams, motivate our clinicians. So if someone tells me, okay, I'm not earning X, Y, and Z and I want to be earning this, I will use the data that I have to guide them and motivate them, to say to them, you know, you could work more productively, more efficiently by reducing your appointment times. Perhaps if you're spending 3 hours on a root canal treatment, maybe you don't need to spend that long on a treatment. If your treatment mix is purely examinations and there's no treatment being done, then perhaps you need to start building in some treatment into your diaries. Otherwise, you're never going to earn what you want to earn. So I think having access to data around what we do at practice level is super key. And within the industry, we need to start using that more to drive our decisions so that our industry can grow and we can remain profitable.
Yeah, absolutely. I think that's something I'd love to see is what, more sharing of that data, because how can we ever benchmark ourselves if we don't know how others are doing? And especially in the DSO world, you're going to want to know what these other DSOs are doing and how they're performing, where you can help them, but where they can help you. And it's only a good thing, because as they grow, the industry grows, and it all gets better for everyone. So absolutely agree. Is there is there something you wish people knew about, like being a leader in a DSO? Like, while we're on that topic, is there something that you think actually not a lot of people understand, that this is how my day to day works? Is there something you wish that you could tell everyone?
I think every day is different, which makes it exciting. What I would like to see is more clinical leaders, I think, within the dental industry. I think being a clinician and then working your way up to a leadership role is so powerful, because you are that voice from the clinic on the ground. And actually, people will listen to you because you know what it's like to treat patients, to work in a clinic. So I would love to see more people coming along on that leadership journey. I think it's important to reach out to people who have done it before, but also not be afraid to create your own path, because I do think practices that have got strong clinical leaders within them will always run a lot better than those without a clinical voice or a strong leader in the practice.
Absolutely,
And
yeah.
that goes for DSOs and independents.
Yeah, exactly that. And I think, you can't forget about the independents, because the more that they grow, the stronger they become. Effectively, eventually, the stronger the DSOs become as well. So I
Yeah, and
definitely think that's
I think
important.
at Colosseum, one of the things that we pride ourselves on is enhancing those skills. So we have future leaders programs, which are actually held usually in Switzerland, and we hold them for all of our 11 countries. We gather future leaders from across the group at different levels of the organization, and we enhance their leadership skills so that they can actually help our clinics grow on the ground. And we do this for non-clinicians, but also for clinicians as well. And that's something that we're continuing to build on, because, as I said, I think the more people you have taking on that leadership role and understanding the clinical and non-clinical aspects of the business, the better you will get as a team, the better you'll get as a business. So within Colosseum, we're really focused on that across our group. And it's been really successful so far when we've been actually running these leadership programs, and I'm continuing to build more of those in the future. So very excited about that. And I think even with early career clinicians, so we've got a foundation dentists early career clinician day coming up next Saturday, and we've got 125 FDs coming, and some of those will hopefully join us as associates later on in the year. For them, from the beginning, as well as learning the clinical skills and the techniques for treatment planning in a more effective way and doing more techniques, I want them to learn commerciality and business skills and leadership skills, because I think that will help them in their career journey. And so I'm designing a program to help teach them that.
Amazing, amazing. And I suppose in that way, and having that education area, do you feel that that helps with recruitment long term? And so obviously we know that there's a big recruitment crisis in the industry at the moment. Do you think that that's something that Colosseum is a bit stronger at because of that education program?
Definitely. I mean, we're hugely proud of our academy that we've built up over the years. And I think offering career development, learning and development opportunities for our clinicians is a big key to the success we've had in recruiting people, because people didn't know about us a few years ago. Now our brand name is growing, it's becoming better. And one of the key things that we pride ourselves on is that education piece, and just helping people grow and move into the right direction that works for them. You know, aligners might not be for everyone, implants might not be for everyone. Whatever you want to do, we will try and work around that to make it work for you, make it work for your career, make it work for how much you want to earn, how much you want to work or not work, what fits for you. Everyone is different. We've got, you know, Gen Z, we've got millennials, we've got the baby boomers, we've got a variety of people working for us within our business. So I do think we need to offer something for everyone, not just target one audience, because everyone likes to work differently. So I'm really keen on that as well, offering different levels of education and development. You're never too old to keep on learning, but you need different levels for each category of person within the business, depending on where they are in their career.
Absolutely, absolutely. I think it kind of leads me nicely into this next question, and we're sort of coming towards the end of our conversation here, and it's I think the unique position that you have is that because you have those programs, because you have so many staff, you get a vast array of opinions on where the industry is going, and you can kind of consume all of that knowledge and build a picture for how you think dentistry is going to be 5 to 10 years. So, you know, having all of that information in your hands, where do you think dentistry is going, and how different do you think it's going to look in those 5 to 10 years?
So I think we're all moving towards a more personalized approach, you know, precision medicine, personalized medicine, oral care plans. It's already being done in other areas of healthcare, but I think we will see a lot more of that happening for us. There are oral microbiome tests which are being carried out for patients, so you can give them specific advice that is tailored towards them. There's a lot more prevention going on as well, and we're looking at curodont repair as well, which is already being used in some of our clinics to give a preventative approach to our patients. There's of course an aesthetics focus that has been around for a while but continues to grow with our patients. And I think it's just about offering the right care for the patient in front of you, but also offering the right environment for the people that work within our industry. So like I said, people want different things out of their working life. Some people want to work part-time, some people want to work full-time. So I think as an industry, for our patients and for the people that work for us, we need to recognize how that is changing and be ready and move along with the shift. Embrace technology, because that's going to make us more efficient, more productive. There's lots of research and development in robotics at the moment as well. So I'm excited to watch and see how that journey unfolds. I don't think it's going to take away the role of the dentist. And I think you will always need a clinician there, because people like that human interaction, right? And they like talking to someone, and they feel safe and secure when they talk to someone. So I don't think that element will change, but I think the tools that we use and the armamentarium that we have around us to make us more efficient and to provide better care is going to evolve. And I'm excited to see where that evolves to and get involved with that.
Amazing, amazing. Well, thank you so much for chatting to me today. I think it's been super interesting. I really loved hearing about that practitioner education piece. I think that's super, super key. Um, what I always do at the end of these pods or these fireside chats is give the floor over to you to chat about something that's going on in with you or your company or a plea you want to give to the industry. So if I could hand over to you just to give that final message.
So all I would say is dentistry is a great industry to be in. Colosseum is a great place to work. We've got a choice of 11 countries. If you want to come and work for us, we're open to talking to you. I'm open to giving people advice who are at any stage of their journey. I love to speak to clinicians from all backgrounds. So please reach out and let me know if you want to chat. I'm available on LinkedIn, on socials. So come and have a chat.
Amazing. That's really lovely. And thanks for offering your help. And, I always end with a question to the audience. And I think that will be my question is if there's one thing that you could ask Dr. Farzeela, what would that be? And please feel free to put it in the comments and we'll see if we can get a response.
I will
So
answer those questions as best I can.
amazing. Thank you so much. So thank you for coming on. It's been wonderful. I've really enjoyed being in this practice environment as well. It's bustling and it's been a really, really great day chatting to you. So again, thank you for coming on. Hopefully see you again in the future. And
Definitely.
yeah, see you all next time.
Thank you.